This is Smita Kumar, and you're watching MediCircle. Today, at our rendezvous section, we are carrying a special initiative series, which is for Patient Safety Day, which was on 9th of December. In this series, we are today talking to Dr. Bhupendra Kumar Rana. He is founding CEO of Quality and Accreditation Institute, a committed global leader in healthcare quality improvement, accreditation, and patient safety. So, welcome Dr. Bhupendra Kumar onto the platform of MediCircle.
Thank you very much, and thank you, MediCircle, for having me here today for this interaction on patient safety. It's really a topic of much desired for everyone, including all stakeholders, and therefore it's very timely and very appropriate. So thank you very much once again for having me here today.
You're most welcome. So to begin with, Dr. Bhupendra, we are having some questions which would let our audience understand, our readers understand what is exactly patient safety and how you people are helping ensuring it is delivered in the best possible manner. So patient safety is a global health priority, hence proved by COVID. So what are your thoughts on the same?
My thoughts are the same as people have around the world, and patient safety is the priority on the global agenda, not just WHO but many other international organizations as well as national governments. And COVID-19 has led everyone around the world to think more in direction. But COVID-19 has also, uh, took us to a next level of safety, that is healthcare workers safety. Because as you know, COVID-19 a disease which is caused by SARS-CoV-2 is very contagious and it's spread like anything. And therefore, the healthcare workers who are providing care to their patients are at high chances of getting this infection. So this year's theme of WHO Patient Safety Day on 17 September basically was focused on speak up for staff safety or healthcare worker safety.
Yes.
So I think Medline has taken a good initiative to talk on patient safety. And because this topic is evergreen, I would say. You can talk this topic anytime, but currently now in COVID-19 also is very, very, very critical and important.
Yes. The theme for this year's patient safety, as you just said, it is like safe health workers, safe patients. What is your contribution towards the safety of the health workers?
Me personally and all the organizations I have been associated with in last several years, I'm sure everyone knows around the world that the first Patient Safety Day, International Patient Safety Day, was celebrated 2019. So the day is 17 September, which WHO Health Assembly has resolved.
Yes.
So every year, 17 September is celebrated as World Patient Safety Day. And in 2019, it was the first Patient Safety Day, and 2020 was the second Patient Safety Day. And unfortunately, because of COVID-19, care worker safety, talk about healthcare workers who are at the front of care in a hospital or healthcare facility, and ensure that patient remains safe. So if you want your patient to be safe, you want to achieve patient safety, it's very important that we want to ensure the healthcare worker safety as well. If they are not safe, then there will be no care and there will be no safety of patients. So we have to really put a lot of efforts around ensuring the healthcare worker safety. So this year theme was very appropriately chosen by WHO in consultation with their several stakeholders to talk about healthcare worker safety, leading to patient safety. Me personally and my organizations have done a lot in that. We have done a lot of awareness campaigns. We have done, poster sort of ceremonies. We designed specific posters circulated to hospitals to display at their hospitals entry gate and prominent areas, so that not only the healthcare workers but patients and visitors can also look at it. And we also we are doing for last 2 years recognizing patient safety champions. So last year we recognized as patient safety champions who are contributing to patient safety. This year, we chose specifically healthcare workers who
Okay.
are contributing to their own safety, ensuring patient safety. So healthcare workers, we run is a sort of a recognition program. We award the certificate to people who really have shown that they have done a good work in patient safety and healthcare worker safety. So this is what we do, a lot of awareness, education, and also do some training programs on patient safety.
That is good to know, because I think if the workers are safe, definitely they would be extending more secure and a better patient care. So
Definitely, it's very it's whole goods for everyone. If a
definitely.
nurse is providing care, and if she has in her mind that she may get COVID, then how will she will pay attention to the patient?
True.
So she might miss the medication, she may give a wrong injection, she might miss some anything means, because
Okay.
she is not uh, what you call free from that fear of getting corona,
Yes.
COVID disease. So it's very important that we have to ensure and assure healthcare workers that they are safe and they can continue providing care to their patients safely.
Very much. This is the digital age, and healthcare is highly influenced by technology trends. So, how do you think this transformation will support patient safety today?
See, this is long due. We just in Corona, in last several months, we are talking about digital health, but it has been in place for last several years in many developed countries. And thankfully, our Ministry of Health now has launched the National Digital Health Mission, NDHM,
India.
which was actually launched by our Honorable Prime Minister, Mr. Modi, on 15th of August this year. And so digital health is a priority for the government because it can bring a lot of efficiency and effectiveness in care and the services being offered by hospitals. And also create a good database of information about not only just the patient, but the healthcare providers, individual doctors, the hospitals. So digital health is a very timely intervention across the globe, particularly in India. And as we see the development of NDHM and the National Health Digital Health Blueprint, which is being spearheaded by National Health Authority (NHA), is a good change and would be a game changer because it would help everyone. It will help the provider because any provider can access the information of the patient, any patient, and from their hospital. It helps the patient because he or she need not to carry all the records with him or her. When they get the patient ID, which is unique, it will be tagged, and that can be accessed anywhere in the country by any healthcare providers. It would be beneficial for stakeholders like insurance companies and payers, and definitely for the government as well. So it would provide an integrated approach of a healthcare service delivery model in our country. And particularly, we envisage this even before this thing were started here in India, after this telemedicine practice guidelines was formally notified by the ministry in the month of March, after COVID has started killing people and taking a lot of toll on the healthcare facilities as well. So we at QAI started thinking on how we can contribute toward this, how we can bring out a product which can help everyone around in this digital healthcare.
Sure.
So we developed a set of accreditation standard for telehealth and telemedicine, and this is first time in India and first time in many parts of the world. As very special standards, and a group of committed experts led by Dr. K.K. Agarwal, the former president of IMA and current chairman of CMAO, led the team of experts to develop, and we targeted it on 15th August to launch after Mr. Modi launched the National Digital Health Mission. So he launched at 9:30 at Redford, and we launched at 12 o'clock digitally through virtual platform. And these standards were launched by Professor Kwan Kham, who is the executive director of International Society for Telemedicine in e-health in Switzerland. So in August presence of several other dignitaries from Telemedicine Society of India and our chairman, Dr. Mishra, and many other dignitaries. So we are at the forefront of, leading this change to standardize. It's not easy. We say telehealth, telemedicine, digital health, but there are a lot of things. We should not go towards a sort of call center approach
Definitely.
because we can't see who is there. So there need to be a process in place. There should be protocols in place.
Definitely.
There should be a mechanism to see how they are providing services to patients. So it's very important, and I think digital health would definitely revolutionize the things in healthcare in India.
So, Dr. Bhupendra, when we talk about patient safety issues, there are a lot of them, like ranging from diagnostic errors, healthcare acquired infections, medication errors, readmissions, or something like wrong site surgery and communication. So, there are a lot of patient safety issues. So, how do you ensure proper patient safety?
See, absolutely, you are right. There are different types of errors being happening in a healthcare facility, and as you mentioned, ranging from medication errors to surgical errors to many other issues which really affect patients, and most importantly, most of them are very much preventable, very much avoidable. How we ensure that at least these preventable harms which are happening around the globe, around the world, in hundreds of thousand numbers, can be prevented. And therefore, we have been in my current role and in my previous role, I have been advocating the role of accreditation, because accreditation standards brings a framework which takes care of all those issues. The accreditation standard requires a healthcare facility to look at the governance, the management, leadership, the human resources, their facility, their information system, infection prevention protocols, medication safety, and how they manage the medications, and how the information is managed. So there's a whole continuum of care to the patient and whole continuum of healthcare service delivery within a hospital. And the standards actually requires hospitals to put a lot of policies and procedures in place, protocols to follow, which led to avoiding these type medication errors. So, say for example, medication errors, when they happen at different stages. As you know, once doctor prescribe it, so there are prescription errors. Doctor prescribes some medicine A, but pharmacist reads B, and so it's gone wrong. So we say that should be legibly written, either capital letters or maybe typed, so that whatever is written is given. Many times, like BDS, TDS, OD, we don't understand. Many patients don't understand what does it mean. So standard says, be clear. You say 2 times a day, once in a day, 3 times a day, before meal, after meal, mention it so that even a layman, a patient can understand. And then second thing happen is, when prescription is done, then it's issuing from the pharmacy, dispensing. Then error, maybe drug A is given drug B, particularly high risk, is very important. And the third step reaches to the patient. So prescription, dispensing, and administration of the drug, the medication, this reaches to the patient. So before it is given, it is checked that yes, this is the drug, this is the dose, this is the route, this is the time, and this is the patient. And so it will check everything, and it will minimize it. And in fact, just to share with everyone here and our listener, that WHO has developed global patient safety challenges. First was the hand hygiene, global, clean care, safe care. Then use of checklist, surgery checklist. Safe surgery saves life. And then latest now in 2018, they have come out with global agenda for medication safety. Medication without harm. Some medication without harm with the theme: no, check, ask. Okay. No, check, ask. So both patient and doctor should know what medication is being given and what he is going to take. Check. Doctor should check. Patient should check. Yes, this is the medicine which is being prescribed. And if you don't understand, ask. So no, check, ask. If you don't understand what is the medication, how it is to be taken, what is the precaution. You ask. So no check ask is global agenda for WHO patient safety for medication without harm. So these are the things, like I gave an example. Similarly, areas, infection prevention, even bed sores, even different types of infections, falls, adverse incident. So these are all preventable, and the standards for accreditation helps them building this framework.
Yeah, like NABH has got so many accreditations, and they have got like 72 to 74 parameters, which includes all these patient safety measures like fall from the bed, and there are so many other things, infections during CNS and other things. So I think if all these hospitals and healthcare organizations are following these guidelines, it would be really better and a safer place for the patients.
I think I didn't mention that I am the former director of NABH.
Okay.
I was there since the beginning in 2006 as a founding deputy director till 2017. So 2017, I was in steering the NABH, and several standards we developed, over 100 standards containing in a hospital set of standards, and around 600 criteria which requires hospitals to fulfill. And in my current role at QI, we developed now a dozen of accreditation standards like home healthcare, dialysis, IVF, green healthcare facilities, primary care clinic, ambulatory care clinic, and telehealth is now the latest. And now we are coming up with the hotel accreditation standards as well. So there are many sets of standards we develop which aims for patient safety, staff safety, worker safety, and community safety. Community is also very important, So the accreditation standards really play a very, very important role for everyone, ensuring the safety at all levels, at all times.
So I think it was really, really great. I really thank you, Dr. Bhupendra Rana, to come to MediCircle and share your wonderful views with us. When we started this initiative, I thought that not only the doctors, but actually there are a lot more other people who are responsible, who ensure that the patient is safe and it has been given the best possible care. So that is why this series, this media campaign was planned. And I'm very delighted that I'm speaking to people like you, knowing more about the patient safety standards, the challenges, what we have in India today with regards to patient safety, and especially the frontline workers, how they can be safe. Because as you said, if a nurse is having the fear of contracting COVID, she would be definitely not in the right shape to give the best possible care. So we need to ensure that our frontline workers are safe, secure, and that is why then they can definitely henceforth give better patient care to all those who need the care at this time. So I think COVID is really the right time here to understand this Patient Safety Day and the series and the responsibilities what each stakeholder has towards this.
Certainly.
So thank you so much, Dr. Bhupendra. And kudos from all the team MediCircle to you.
So thank you very much, Smita and MediCircle, for having me here on this very special topic of discussion and talk of patient safety. And we look forward working with you and collaborate with you in such media campaign, which is beneficial for everyone, every community, every patient, everyone around the country. Thank you very much once again, and wish you all the best.
Thank you, and you're most welcome.